You put in endless hours marking papers, calculating scores, and logging grades, only to see the exact same students fail in the exact same way. Many educators find themselves trapped in a cycle of constant testing that provides plenty of data, but very few actionable insights to help struggling learners improve. When grades stagnate, the instinct is often to increase the frequency of pop quizzes or tests, but more frequent testing often just deepens assessment fatigue for both the teacher and the student. High-effort grading that fails to move the needle is usually a signal that the tools being used are mismatched with the goals of the instruction. To fix this, we have to separate the act of evaluating a student's overall achievement from the act of investigating the specific root causes of their learning gaps. Attempting to use an evaluation tool to figure out why a student is failing is like using a tape measure to diagnose a fever. It provides a measurement, but it's the wrong kind of information for a diagnosis. Solving this requires a clear understanding of two distinct educational tools, the achievement test and the diagnostic test. Applying an evaluation tool when deep investigation is required makes it nearly impossible to identify the specific cognitive errors that are blocking a student's progress. An achievement test is designed to measure a student's general ability to meet broad course objectives at the end of a learning period. This comparison table shows these tests cover a wide area of content. They utilize complex questions and operate under strictly fixed time limits. Because of this design, the test yields a single quantitative score. It tells exactly where a student ranks against a standardized norm. While this number is useful for a transcript, it has a functional limit in the classroom. The score confirms that a student failed, but it doesn't explain the logic behind their mistakes. Achievement tests are efficient tools for end-of-term grading, but they offer very little help when you are trying to provide instructional feedback or clear up a specific confusion. A diagnostic test works differently. Its primary function is to locate specific learning deficiencies and uncover exactly where a student is stuck. Under the diagnostic test column, the structure changes. It uses simple, clustered items, focusing strictly on historically difficult concepts, removing all time limits. These tests don't require an overall score. Instead, they generate a qualitative map of individual strengths and weaknesses for each learner. Rather than just knowing a student failed a math unit, a diagnostic test might show their failure is tied strictly to a repeated inability to carry a decimal. Choosing diagnostic testing means trading a clean, easy grade for the deep analytical data required to actually fix a learning gap. Identifying a specific learning gap is only useful if it leads to a targeted intervention. This diagram shows the relationship between these phases. The diagnostic test is the catalyst for remedial teaching, specialized instruction designed to correct exact deficiencies. This cycle requires significant teacher effort to hypothesize the cause of errors, group students, and arrange custom corrective materials. This shifts the classroom dynamic from a general lecture to managing multiple group tutorial or individual tutorial situations simultaneously. While this process can eliminate bad habits and prevent future errors, it requires a massive upfront time investment in planning from the educator. Providing individual tutoring for every unique student error during a standard class period is a logistical impossibility for a single teacher. To scale this effort, we can use auto self-learning. This strategy hands the responsibility of overcoming specific difficulties over to the learners themselves. For this to succeed, corrective materials must be perfectly graded, completely self-directive, with highly readable written directions so students can progress independently. During this phase, the teacher's role shifts. Instead of direct instruction, the educator acts as a supervisor, monitoring individual progress and stepping in only where needed. Investing time into creating these independent instructional modules frees up significant teacher bandwidth during actual class time. Deciding which assessment tool to use depends entirely on the goal of that specific lesson. Use an achievement test when you need to assign a final grade or benchmark general ability against standardized norms. Use a diagnostic test in the middle of a unit when students are visibly stuck, or when you are designing interventions for students with special needs. Separating these two functions clearly in your planning is the most effective way to prevent assessment fatigue. Achievement tests indicate that a house is on fire. Diagnostic tests identify exactly where the fire started. Conflating evaluation with investigation in your curriculum planning often leads to redundant work with very little instructional gain. Auditing your current assessment strategy can help you identify where an achievement test is being used to solve a problem that requires a diagnostic approach. The ultimate rule of educational assessment: never administer a diagnostic test if you are not fully prepared to follow up with targeted remedial instruction. Diagnosis without treatment is just a wasted class period. Selecting the right tool for the job ensures you are actively closing learning gaps rather than simply documenting them.